Hello, my name is Carla Martinez, and I study of Universidad Católica Santiago de Guayaquil. I am going to talking about the central pontine myelinolysis. Definition: Central pontine myelinolysis or osmotic delimitation syndrome is associated with a rapid correction of sodium in hyponatremia, with symptoms that appear between the second and sixth day of the diagnosis of electrolyte disturbance. It is characterized by destruction of myelin at the pontine level, although it can affect other extrapontine regions. Application in medicine. Treatment: The ideal treatment for myelinolysis is to prevent to disorder by identifying individuals at risk and following careful guidelines for evaluation and correction of hyponatremia. These guidelines aim to safely restore the serum sodium level while protecting the brain. Central pontine myelinolysis (CMP). Central pontine myelinolysis was originally described by Adams and colleagues in the 1959. He first detailed the need in a group of malnutrition and alcoholic patients. Future studies and advances in medicine have shown that CMP most complete resulting for the rapid correction of serum sodium in hyponatremic patients. Neurologic complications of alcoholism. The majority of cases occur in alcoholism, suggesting that alcoholism may contribute to the genesis of central pontine myelinolysis. Postoperative intensive care management in the adults. There is no treatment for CMPs, so the goal is prevention. Care must be taken in the ECU to correct the hyponatremia after transplant. Postoperative ACU management adult liver transplant recipients. At Baylor University, we have set a lower limit of sugar and acceptance pre-transplant serum sodium at 128 milliequivalents per liter for patients whose condition is not emergency. Hyponatremia. Risk factors include a change in serum sodium level of graded to 12 milliequivalents per liter in 24 hours, correction of serum sodium level to a hyponatremic rank coexisting alcoholism, malnutrition, and liver disease. Neuropsychiatric complications. CMP is a several neuropsychiatric complication of liver transplantation. The incidence after liver transplantation is a 5% to 10%. The clinical presentation is varied. In some cases, it can be asymptomatic or silent. Extrapontine lesions. Extrapontine lesions can occur in the basal ganglia, internal capsule, lateral genicular body, and cortex. Symptoms include motor abnormalities and can progress to flaccid quadriplegia, respiratory paralysis, mental status change, and coma. Central pontine myelinolysis is often fatal in the 3 to 5 weekends of the patients who cerebellum may have significant residual deficits. Alterations in the Wien meter are best visualized by magnetic resonance imaging. Pros and cons. Pros: As most patients with hyponatremia do not develop CPM, although some patients with relative mild osmotic insult, it has been suggested that there must be often predicting factors. Owing to specific therapeutic approaches to prognosis of CMP be improved. Cons. General outcomes of CPM after liver transplantation we have reported to be poor. CPMI association with Mercari big name syndrome, which is a rare disease of the corpus callosum and occurring in the alcoholics. Although classic cases are purpose delimitation, several case demonstration, significant nutrition and cavitation. Yunsu Daplig in Ecuador. Report of case. This is a case of the 21 years old patient presented With a weakened permanency who attends emergency because an abnormal weight often die of the evolution accompanied with a weight loss of 8 kilograms, not compensated by the large amount of liquids consumed during the same periodic. Laboratory tests show hemoglobin values of 8.3 grams per liter, sodium is 157 milliequivalents per liter. Normal values 135 to 145 milliequivalents per liter. MRI relative hypnotism lesion symptomatic with diffusion restriction in shape of Barwin over the Pontine region no affect to mass or compression of the other structure suggestive of osmotic delimitation. Allen normally of the electrolytes were gradually correct except for hypokalemia. The patient was able to walk with minimal limbs weakness after the day of income. The patient was described at 25 days. Conclusions. The first case were described in patients with a history of alcoholic malnutrition. We over in the subject reports. CPM has occurred most frequently in association with rapid correction of hypernatremia. Central Pontine Myelinolysis is one of the most feared complications of therapy for hypernatremia. The introduction of MRI made ascending more to diagnostic considered easier, although radiology finds the leg being the clinical picture. Video.
Central Pontine Myelinolysis. What is central pontine myelinolysis? Central pontine myelinolysis is a condition in which there is acute paralysis, dysarthria, dysphagia, diplopia, and loss of consciousness. This is a condition that can cause locked-in syndrome, and in this there is massive axonal demyelination in the pontine white matter tracts. What is the cause of central pontine myelinolysis? The cause of central pontine myelinolysis is iatrogenic, which means it's physician induced, and this is caused by overly rapid correction of the sodium levels. So when you correct hyponatremia, you do it very fast, then central pontine myelinolysis can happen.
Thanks.